Good morning, everyone. We're going to give it a minute or two to allow other folks to join. Thanks for hopping on right at 11. Please put your name and organization in the chat, and then we will get started shortly. Thank you. Good morning. I'm just going to give it a minute or two more, and then we'll get started. Just want to make sure we allow everyone to join who would like to, and then we will get started. Please enter your name and organization in the chat. Also, this meeting will be recorded, and the materials will be available following the meeting. Okay, I'll give it one more minute and then we'll get started. Thank you for your patience. Okay, I think we can get started. Thanks everyone for joining. My name is Kyle Bartlett. I am a mental health program specialist here at the Office of Mental Health at Central Office with the Division of Crisis Services. I appreciate everyone joining. So we are going to be discussing the Comprehensive Psychiatric Emergency Program RFP today. I'm joined by a number of my colleagues, some who you will see here listed on the screen, and some who are not listed, but feel free for folks, OMH folks who need to jump in, feel free to unmute yourself and add anything as we go through. I'm going to ask some of my colleagues to introduce themselves. I'm going to go with who I have on my screen here. Dr. Jennifer Goldman, if you could introduce yourself.
Hi, everyone. I'm Jennifer Goldman, Medical Director for Crisis Services with OMH.
Thank you. And do we have Chris or Sarah on yet from OMH? Okay. So with that, I think we'll get started. If other folks from OMH need to introduce themselves, I'll ask them to do so as we go through. So I will go through a bit of the meeting info, and I'd ask folks to please save their questions till the end, and we will have some time towards the end for question and answers. Okay, so this meeting will be recorded and available on the OMH procurement website. I assume most folks are familiar with that. That's probably how you got to this meeting today. But if not, there is a slide at the end that will give the link to that website. Participants will be muted due to the size of the meeting, so everyone is muted, but you do have the ability to unmute yourself. Questions, we would prefer questions be submitted through the chat box towards the end, just kind of keep things a little organized. So as we go through, some questions may be answered in further slides. So let's just try to save some questions towards the end. Any questions that are not answered today will be responded to in the official question and answers that will be posted on the OMH procurement website. Those questions and final answers will be posted on March 3rd, 2026. And for those who just joined, if you could please introduce yourself in the chat with your name and your organization. Okay, so this is Capital for Expanding Comprehensive Psychiatric Emergency Programs Round 2. So in 2023, there was the first version of this RFP, and you'll see that there have been some changes and things look a little bit different here. So if you're looking for this on the procurement website, it's the Capital for Expanding Comprehensive Psychiatric Emergency Programs Round 2. Okay, so here's just a little basic overview. So this RFP was issued on January 6th, 2026. There is $20 million available in capital funding and $3 million in startup funding is available through this RFP. And as we go on, you'll see there's some nuances there that we will discuss. Projects must demonstrate an ability to provide the appropriate need-based CPEP services and be able to complete the capital project in a timely manner. Applications are due on March 24th, 2026. Okay, so a little more of the nuance here. Up to $5 million per award in capital funding is available for new comprehensive psychiatric emergency programs. So that will be development of new CPEPs. However, given the need for new CPEPs that serve children, this also will include an expansion of existing adult serving CPEPs to add capacity to serve children. So if you operate a current CPEP and you're only serving adults, this is a possibility to receive those capital funds if you are awarded. Capital funds may be used for any physical plant changes to serve children and youth, such as separate family-friendly waiting areas, evaluation and treatment space, and distinct EOB spaces. $1 million in startup funds is available for CPEP awardees developing new CPEPs or adding capacity. So in addition to the capital funds, there will be $1 million available for 3 CPEPs that are awarded for startup funds. Okay, so this you will see is a bit different from the RFP that was released in 2023. So this RFP allows for some applications for milieu improvement. So up to $1 million per award for expansion and or renovation of a CPEP is available for the purposes of improving the milieu and increasing the availability of CPEP services. Milieu improvements may include increasing the footprint of treatment areas, waiting areas, group activity areas, the number of EOB beds, and improving the space and safety of the unit to adequately provide for services. So this is something that we have not allowed for in the previous RFP. So this is pretty exciting, something different. So I encourage folks to take a look at the RFP itself to review the nuances here. And please note, milieu improvement projects cannot decrease the square footage or number of EOBs. Okay, so we'll say a little here about the eligible applicants. Obviously, a lot of this is going to be included in the RFP itself. So the eligible applicants are New York State Public Health Law, Article 28, licensed general hospitals, organized as a public benefit corp, county operated program, government entity, or as a non-for-profit exempt from federal income tax under Section 501C. Additionally, Applicants must currently operate programs that are licensed, certified, or otherwise authorized by OMH and be in good standing with the Office of Mental Health. For example, not under enhanced provider monitoring by OMH. Pre-qualification is required for all not-for-profit organizations seeking grant funding from New York State. And please be advised that all questions regarding eligibility will be responded to through the official posting of questions and answers. No questions about eligibility will be responded to individually or prior to posting the Q&As. So also, with that said, we will not get into eligibility specifically today, but you can ask that question in the official Q&A. Okay, a little bit here on the capital budget. So applicants must complete an itemized capital-based budget in SFS. This should provide detailed project expenses for the proposed capital project expected after the date of contract execution. The itemized values must clearly distinguish between expenses to be claimed under the state grant share and expenses to be covered by alternative sources of funding if applicable. Please indicate amounts for any applicable funding necessary for the project other than the funds requested under this RFP. So the RFP is intended to address capital needs for the provision of CPEP main or satellite sites in one or more of the following areas: acquisition, purchasing of real estate with an existing structure or vacant property on which a new structure can be built, construction, building a new structure for the purpose of providing CPEP services, and rehabilitation, restoration of existing structure for the purposes of providing additional or new CPEP services. In addition, it's important to note that these programs will be licensed by the Office of Mental Health, and physical plants will require compliance with 14 NYCRR 590. So that's the regulations for CPEP. And I just wanted to add here, as you can see, CPEP or main satellites. So for the purposes of this RFP, a new CPEP will also be considered, a satellite will be considered a new CPEP. Okay, so this is a bit more complicated than our previous RFP, and I encourage folks to take some time and review the application itself, the RFP itself. So up to 3 passing applications to fund a new CPEP program will be funded before applications to improve the milieu of existing CPEPs. So these 3 applications are going to be the priority. Within passing applications for new CPEP programs, funding will be awarded as follows. A maximum of 1 award will be made per economic development region. And as you can see, the economic development regions are noted there. OMH prioritizes the equitable distribution of CPEP services. The highest scoring applications for the Long Island and Capital District economic development regions will be funded before applications for other EDRs. This is in order to address significantly limited CPEP services in these areas. The additional EDRs will be awarded in rank score order. So I encourage folks to take a look at that in the RFP. This is a little different. So we'll really focus on Long Island and Capital District will be funded before other applications, as there are limited CPEP services or no CPEP services in those areas. If there are fewer than 3 new CPEPs awarded across 3 EDRs, additional awards will be made in EDRs that are already awarded. And applications that propose lifespan services will be awarded over those proposing only children or only adults. Applications that propose to serve children only will be funded before those that are only adult serving. Okay. So I'm going to say a little bit here about the operations of CPEP. If other folks from OMH want to hop in, feel free. So for CPEP operation, obviously LGU collaboration is a vital part of the work of comprehensive psychiatric emergency program. Applicants should notify their LGUs of their intent to apply, and proof of this notification is required to be uploaded in SFS. Some basics about CPEPs here. CPEPs are open 24 hours per day, 7 days a week, and they provide a full range of psychiatric emergency services and crisis outreach services within a defined geographic area to individuals experiencing symptoms of a behavioral health crisis, including co-occurring disorders. The main components of CPEPs provide triage and referral services, full emergency visit services, extended observation bed services, and crisis outreach services. So that's the mobile component of mobile crisis and of the CPEP. So additional CPEP operations, CPEPs are adequately staffed with a multidisciplinary team. Staffing plans will have the ability to meet the needs of the service area and the populations being served. Staffing numbers are based on the needs of operating a 24-hour per day, 7 days a week facility, and will reflect demographic data obtained on the catchment area. And in addition, extended observation beds are available 24 hours per day, 7 days a week as well. They are located in or adjacent to the emergency room of a CPEP, and EOBs provide a safe environment for an individual who, in the opinion of the examining physicians, require extensive evaluation, observation, and assessment for a period up to 72 hours. Okay, so here's some key timelines here for the RFP. So the RFP was released on January 6th, 2026. Today we are having the bidders conference. The questions will be due, the official question and answers will be due on February 10th, 2026. So you can find that process on the procurement website. The questions and answers, so the answers will be posted on the website on March 3rd, 2026. So you will see those answers come in the beginning of March. The proposals will be due by 2 p.m. on March 24th, 2026. So we tried to space this out to give a little bit of time for folks. And the anticipated award notification is May 5th, 2026. In addition, the anticipated contract start date, we found that to be a bit difficult to estimate, so that will be to be determined, as folks who have experience with this can probably attest that that sometimes takes a little bit of time. Okay, some basic RFP instructions. All applications must be submitted through the statewide financial system. So for folks who aren't familiar, this used to be done on Grants Gateway. Now we're doing the statewide financial system. Please begin working on your application in SFS no later than 5 business days before the application due date, and submit no later than 48 hours before the due date. This will allow you some time to troubleshoot any issues that arise that may prevent you from submitting. Please note that there are restrictions to the type, size, and naming conventions of the files and attachments uploaded in SFS. For more information, please review the SFS attachment guide. Okay, so these are some helpful web links. I strongly encourage folks to please review these. Probably be good to review as you're crafting your application, or even review prior to beginning that. The CPEP regulations can be found at Westlaw. That's CPEP Part 590. In addition, CPEP Part 591 are the billing regulations. And then an important piece of guidance is the evaluation and discharge guidance created by OMH and DOH in, I believe, 2023. And agencies must conform to all OMH fiscal reporting requirements as outlined in the consolidated fiscal reporting and claiming manual. And these guidelines are available at the bottom. Just going to pause my screen 1 second. Okay, so you'll see on the screen here, this is the DOH and OMH guidance on evaluation and discharge practices for CPEPs and 939 emergency departments. This came out in October of 2023. So I strongly encourage folks to review that for this application. Moving over to here, you will see the procurement opportunities. This is on the OMH website, which I'm sure most folks are familiar with. Right here, you can see the RFP itself. And when we click on that, this is where you will find this recording will be posted, as well as the slides and the Q&A. So that will be where you're going to want to go to handle that. And over here, the Part 590 operation of comprehensive psychiatric emergency programs, which is very important to review. Okay. Okay, so we will get to questions and answers shortly. I do know that some folks from OMH have hopped on, so I'm going to give them some time to introduce themselves. I believe Sarah Kuriakos is on. Are you able to introduce yourself?
Good morning, everybody. Thank you so much for joining us at the Bidders Conference, and thanks, Kyle, for walking through all of that. So I'm excited for the question and answers.
Thank you, Sarah. Would anyone else like to add anything from OMH before we get into the question and answers?
I would just add that I think that this RFP has been developed partly in response from provider feedback about what the needs are of CPEPs already in operation, those in development, and then those regions that may not have one. So I think the positive with that is that there's there's flexibility and different opportunities built within this RFP. I think the flip side of that is that it can be a little more complicated to understand the different opportunities. So this, we do encourage you, please take advantage of this opportunity to send in questions, and we can try to provide any additional clarification for those that need it. Thank you.
Thank you, Dr. Goldman. Okay, so we will get into the questions and answers. So I'll just start going through the chat here. So we have a question here for new programs. Would we need to submit a budget for the startup funding request as well, in addition to the capital budget? So the answer to that is yes, there would need to be a budget submitted for the startup funding. Typically, the template is very similar or close to the same as the capital budget, and that should be in SFS. This would be for developing the new CPEP. So milieu improvement will not be eligible for the startup funding, but for developing a new CPEP, adding capacity, or developing a new CPEP satellite, that would be eligible for the startup funding that would be required, a budget would be required. Okay. If a planned CPEP capital project is expanding the overall footprint of the existing program, adding more EOB beds and adding a more defined PED CPEP, how should it be categorized in the application? So I believe here, so Patrick, correct me if I'm wrong, I believe we're talking about this may be a CPEP that already serves children and will be adding a more defined PED CPEP. That will most likely be milieu improvement. I think I would encourage, we will take some of that back and respond to that officially in the questions and answers. But my first guess would be, because if a CPEP's already serving children, that would most likely be the milieu improvement, because it technically wouldn't be adding capacity. but we
Is it
will,
okay if I add a couple pieces to
yeah,
that?
definitely. Go ahead.
Yeah, just I think I mean, you have it correctly, right? We're serving children, but it's not a PED CPAP per se. We sort of have, this kind of dividing of the milieu to be able to evaluate kids. And what we're planning for, and really could use, some capital support, is really truly have a separate CPAP for peds and a separate, space in CPEP for adults. And then in addition to that, on our adult CPAP, our goal would be to increase our EOB beds. So it's kind of looking at it. Yes, there's expansion of space and milieu improvement will sort of be in that, but we're really expanding capacity and adding the really dedicated PED CPAP area as well as increasing our adult EOB beds would be the goal.
Thank you. So one thing I'm thinking, so there are CPEPs. If a CPEP was going to open an entirely new CPEP to serve children only, that would probably most likely meet the criteria of the actual new CPEP. However, adding capacity when the CPEP already serves children is a little difficult. So I would encourage you to take a look at the RFP, really read through that, and you can submit questions in that official question and answer, and we'll be able to really take that back and take a good look at it and put those in the response for everyone. Anyone from OMH want to add anything to that?
I agree with you, Kyle, on that. And thanks, Patrick. That we'll make sure that because this is recorded, that all of your detail is captured in the question that goes in the Q&A document and answer that question.
Okay. Is there a due date for the LOI? I believe that is letter of intent. I believe that would be submitted by the RFP application date. However, I just want to call on our support from our procurement office, Jerry or others. Any thoughts on that due date for the LOI? Would that be at the time that the application is due?
The requirement, my name is Jerry Whitcup. I'm the procurement officer for this RFP. The due date for that notification of the LGU is the date it will be included as an upload with the rest of your information in your bid proposal.
And it's not an LOI sorry, this is Amanda Sapkowski, also from the procurement unit. It's not an LOI in the sense of, a mandatory notification to us, as you would think of a traditional letter of intent. Like, there is no letter of intent requirement. This is a letter that you would be sending to the LGU, notifying them that you intend to apply, and that gets uploaded with your application. So as long as you do it before the deadline and put it into your application, you are good. But it's not a letter of intent. It's a notification to the LGU.
Thank you for that clarification, Amanda. Okay, the RFP states that both a capital and operating budget are required. Does this apply to milieu improvement projects or just new CPEPs, or is just a capital budget acceptable? So for the milieu improvement, I would have to double check the actual language in the RFP, but we will take this back and make sure that's clear in the questions and answers. I believe it's specified specifically in the question piece, but I just don't have it readily accessible. Okay, and just confirming I heard you correctly, if a hospital wants to apply with a child-only CPEP in mind, that is allowable. Correct. If your hospital already operates an adult CPEP and you are applying to develop an entirely new child CPEP, that would be something that could be included in your application. And for the staffing model requirements, is a psychiatrist required to be in person 24 hours a day, or can the psychiatrist be accessible via telemedicine and or an app on site? So typically CPEPs are required to have a 24-hour a day psychiatrist. However, there is in CPEP Part 590 a section that speaks to a possibility of a waiver for that if a CPEP is serving under 3,000 people per year. So I would encourage folks to take a look at CPEP Part 590 and focus in on that waiver piece. That would be, it used to be called a rural CPEP. Now it's that language has been changed, but it's less than 3,000. So I encourage folks to take a look at that. And I strongly encourage folks, if that is something included in your planning, to please include that in the application. Okay. Can you clarify if there's a region-specific preference? So let me just go back to our evaluation criteria. So I think what you may be speaking to, so this second bullet here, OMH prioritizes the equitable distribution of CPEP services. The highest scoring applications for the Long Island and Capital District development regions will be funded before applications for other EDRs. So I believe that's answering the question, but feel free to unmute and ask if there's more nuances there. And I see that Tina just added, so they do not currently have an adult CPEP. They would only want to do a child CPEP, which yes, absolutely. That would be something here that if you could see at the bottom, applications that propose to serve children only will be funded before those that are only adult serving. So we are prioritizing child CPEPs there. So I would strongly encourage that application as well. Okay, so other questions? We have a bit of time, so I'll give folks a few minutes. If they'd like to ask any specific questions, feel free to do so in the chat. And while folks are thinking about that, anything from the procurement office that you would like to add or anything that we need to discuss? Okay, anything from other folks at OMH that would like to speak, or anything that would be important to let folks know on the line? Okay, so these conference slides will be posted using the link below. So these slides will be out. If you do need to find this, you can just Google probably OMH procurement and that will come right up. The official questions and answers will be accessible using the same links and will be available on March 3rd, 2026. And if folks have any other questions, feel free to unmute. If anyone who asks questions and needs a little more clarification, feel free. So we will stay on for a number of minutes. I want to say thank you to everyone for tuning in. We appreciate it. Please take a look at all those links, and we look forward to seeing what applications come in. Thank you so much.
Thank you.
Hi, this is Taina from Lincoln.
Hello.
I just have a question regarding the budget. In one of the slides, it says that please indicate amounts for any applicable funding necessary for the project other than the funds requested. So does that mean that if our project, we estimate it's over the 5 million or 6 million if it's a startup, with the startup, do we also indicate it there?
So what that is speaking to is in the past some CPEPs, so it's 5 million, so possibly let's say there's a total 10 million cost for this. We would want to see how the other funding, how that will be paid for that may not be covered by all the capital. Does that speak to what you are asking?
Yes, but what I'm also asking is, do we, let's say for instance, if we go over the 5 million, and it's included with the whole, I guess, let's say for instance, construction, or however it is that we're gonna, do the project, do we add it, do we give you a budget of like $10 million and then say, obviously 5 million would be you guys, and then 5 million would be another source, or do we just give you a budget for 5 million but indicate the project is actually 10?
That's a good question. I would have to take that back and double check because I want to make sure I'm giving you the total, the complete answer to that. So please review the questions and answers. All these questions are going to be taken back and we're going to put them out on the question and answer attachment that will go out. So we will make sure to answer that. Thank you.
Thank you.
And then I see from Jennifer, is a satellite CPEP considered a new CPEP for purpose of this opportunity? Correct, it is. Yes, a CPEP satellite is considered a new CPEP for the purpose of this RFP. Thank you, Jennifer. So we still have some time, so if there are other questions, feel free to unmute or feel free to ask the question in chat.
In the meantime, Kyle, I just want to thank you for walking all of us through this and also to thank all the attendees. We're really excited about the interest in this RFP and invested in, the successful development of additional CPEP services. So thank you all for your participation today.
Yes, I second that. Thank you, Jen. So I saw a question from Jennifer. Please confirm the applicants for milieu improvement are not required to complete the budget template. So there will be a budget piece that is needed, but I can't recall the specifics there, but we would need to see a budget. So I would encourage you to review the RFP there relating to the operating budget. So I will take that back and I will put that in the questions and answers just because I want to make sure I'm talking about the specific budget. But there will at least be some piece of budget template required, but it should be specified in the questions. And if it's not, we will make sure that is specified in the questions and answers. Thank you, Jennifer. Okay, so we will stay on for another 5 or 10 minutes. If folks have more questions, feel free to ask. If not, we appreciate everyone attending. Thank you so much. And all this information will be included on the OMH procurement website. I see a question just came in. Will Long Island and the Capital Region receive any priority for the Milieu Awards? So the priority for the Milieu Awards, there is not priority there. So the priority is going to be specifically for the new CPEPs, and then once those are awarded after 3, then the considerations for the milieu improvement will be considered. Thank you, Lucy. Have a good day. I see a question. How much detail do we need to include for the construction project? Would this be the milieu improvement or a new CPEP? Just want to make sure I'm getting that correct. New CPEP. Yeah, so we tend to like to see quite a bit of detail. However, given, a lot of this is based on things that might be difficult to know when you're putting in an application, I would encourage, to put as much detail as possible, but we will also expand on this in the questions and answers. And if you have specific questions about what we would like to see or what should be included, you can put that in the official question and answer as well. I encourage you to review the RFP, see what the questions are pretty specific. So I think you're going to see there what is going to be required.